attempted to demonstrate the efficacy of fenugreek as a galactagogue. This was not a randomized trial, but rather a pre-test post-test design with no control groups, wherein the volume of NUC was compared in a single cohort before and after administration of fenugreek. Because former published data are lacking, this study was done to determine the efficacy of fenugreek supplementation on breast milk production. Specifically, to determine the difference in the breast milk volume of mothers who have taken fenugreek versus that of mothers given placebo. Second, to enumerate the adverse effects of patients in the above groups. And lastly, to determine the level of maternal satisfaction with fenugreek. This was conducted among postpartum mothers with infants with an indication for tube or cup feedings, and those who volunteered are included. The following are the exclusion criteria. This study is a triple-blind randomized controlled trial. Once they fulfilled the inclusion criteria, mothers were approached prior to delivery or postpartum. After informed consent, mothers were randomized to receive fenugreek or identical capsule, similar in size, color, and smell, containing commercially available clark as the placebo. Assignments were concealed using sealed opaque envelopes, and mothers were instructed to take 3 capsules of the study intervention 3 times a day for 5 days. Contents of the capsules were unknown to the investigator, participants, and study personnel. After proper orientation and training on the use of the collection forms, mothers were instructed to collect milk for 5 days, and the volume was measured using standardized containers, and the time of collection was recorded. Those who were discharged before the end of the collection period were given the remaining capsules to complete 5 days, and were instructed to complete the data collection. In this form, mothers recorded the total volume of milk collected. This volume was adjusted for the number of hours between collection and converted to average volume per hour. A standardized universal satisfaction scale was given to all mothers and submitted at the end of the study. And the patient satisfaction was based on the following domains: ability of the medication to increase milk volume, the side effects experienced, interference with physical, mental, and emotional health, the ease of use, and the benefits that outweigh the side effects. Chi-square was used to determine differences in the categorical baseline variables. T-test was used to determine differences in the continuous baseline variables, and the difference in the breast milk volume per day was analyzed using T-test. The sample size was computed using the formula POCAP for the difference between 2 means, using a mean difference in volume of 98 ml and a standard deviation of 100 for the treatment group and 64 ml for the control group, based on the study on Malunggay of Estrella and Mantarin in 2000, an alpha error of 0.05 and a beta error of 0.2. The sample size were computed at 25 per group. However, to adjust for the possibility of dropouts, 30 per group were recruited. A total of 60 patients were recruited, and the results are for the 36 mothers who have completed the data collection. 24 mothers were excluded from the analysis. There were 23 dropouts who withdrew consent and did not comply with the intake of the study medications, 12 from the fenugreek group and 11 from the placebo. Then 1 mother from the control group took the study medications as instructed, but directly breastfed her infant for the entire study period and had no data for the amount of milk collected. Thus, a total of 36 mothers were included in the analysis, 18 from the fenugreek group and 18 from the placebo. This table shows no difference in the baseline characteristics of mothers randomized to both groups, and the mean volume of breast milk collected on postpartum days 1 to 5 is shown in Table 2. A statistically significant difference between the fenugreek and placebo group was seen on day 1 through day 5. Milk production in the fenugreek group on day 2 was almost twice that of the placebo group, and this was sustained until day 5 with an average 80% increase in volume production in favor of the fenugreek group. There were no reported serious adverse events in both groups. 2 mothers who took fenugreek reported breast tenderness, hunger, headache, and maple-like smell of urine, while 2 mothers in the placebo group reported reactions in the form of pruritus and rashes. These mothers had concurrent intake of antibiotics. With regard to satisfaction satisfaction ratings, majority or 81% were satisfied to extremely satisfied and 0 reported dissatisfaction. Our current study demonstrated the lactation-enhancing effect of fenugreek as evidenced by the significant increase in the volume of milk expressed by mothers given fenugreek. Although the exact mechanisms of actions are still unknown, it is hypothesized that fenugreek may increase milk flow by phytoestrogen and diastrophin contents, and is suggested to stimulate sweat production, which would enhance milk secretion since the breast is a sweat gland. Among the commonly reported effects of fenugreek as observed in the studies by Goldrich and Tiran, only 2 reports of maple-like smell of urine and breast tenderness were noted. In summary, fenugreek significantly increases the volume of breast milk produced by mothers on postpartum days 1 to 5 compared to placebo. Side effects noted are maple-like smell of urine, breast tenderness,